Hi, this is Dr.Pentyala, radiation cosmetic surgeon and the director of the Cosmetic Clinic, Bangalore, India. Today I'm going to speak about rhinoplasty in detail. Rhinoplasty is typically, rhino means nose, plasty means reshaping. It is typically the reshaping of the nose. It is also called as a nose job, cosmetic surgery of the nose, or plastic surgery of the nose. Well, like any surgery, rhinoplasty has a certain, post-operative pain, which will be taken care of medications. But the pain factor in rhinoplasty is very negligible, so one need not to be worried about the pain following the rhinoplasty. Well, in rhinoplasty or no job, what the surgeon is going to do is typically going to alter the size and shape of the nose, where the size and shape of the bone, the nasal cartilage, and sometimes the base of the nostrils, where we do a skin excisions. Totally, typically we are going to alter the size and the shape, and we are going to give the angulation for the nose. Well, following rhinoplasty, many people are concerned, whether rhinoplasty changes the complete shape of the face. Rhinoplasty doesn't change the complete face. It only going to alter the size and shape and give the angulation of the nose, which will aesthetically suit the rest of the face. Well, rhinoplasty can be done on any individuals who are usually not happy with the overall size and shape of the nose and who wants to enhance their nose which best aesthetically which best suits to the face. Anyone can undergo rhinoplasty to enhance the facial appearance. Well, following rhinoplasty, most of the rhinoplasty incisions are placed inside the nose, other than a small incision which is placed at the base of the nose, that is called as columella. Sometimes we place an extra incisions for the nostrils direction at the base of the nose. Most of the incisions are hidden in the skin crease, so one would hardly have any visible scars. If any visible scar is there also, maybe in 4 to 6 weeks time, it is going to blend in the natural skin. Well, one need to be very careful while undergoing any cosmetic surgery, and rhinoplasty is not an exception. Usually people with realistic expectation, complete and thorough understanding of the dynamics of the nose, people who are very cooperative are the ideal candidates to undergo rhinoplasty. Well, rhinoplasty is not at all advisable and is suitable for the patients with any psychiatric, fluctuations in the mind, and people who are unrealistic with expectations, who are uncooperative, and people who comes with the photos or pictures of their ideals with celebrities, and who wants to get the nose similarly to like the celebrities. Those people are not and definitely are not an ideal candidate for rhinoplasty. Well, rhinoplasty is the same procedure if done by an experienced surgeon. However, like any other surgeries, rhinoplasty also have a few risks. But the risk factor in rhinoplasty is very rare. If rhinoplasty is not done properly, for example, gastroscopies the cuts are not done properly, it leads to sometimes little bit impairment in the vision, prolonged edema, swelling. Sometimes prolonged oozing also may happen, but however these risks are very rare. You can one in a lakh, one in 100,000s you can come across such risks. But however, with proper preoperative precautions and proper planning of the surgery, these risks can be minimized. Well, following rhinoplasty, many people will ask whether they can smile or do any exercises following rhinoplasty. Yes, obviously, they can. There is no problem with the smile aspect or speaking. But however, following rhinoplasty, we advise the people to talk and smile, not talk and smile too loudly. Okay? Then also the exercise, extreme exercises like the swimming, gymming, and exercises should not be done for the 2 to 3 weeks following rhinoplasty. But however, after 3 weeks, one can resume their normal activities. But going to the job and other things can be done from the very next day. However, one would have a small split on the top of the nose. There is no problem with that. Keeping the split, one can do that regular activities, but not the strenuous exercises. Okay, following rhinoplasty, the recovery following rhinoplasty is usually hardly a week's time. As I said, from the very next day one can resume their regular activities other than strenuous exercises and all. You can hardly say the internal healing could take place up to 2 to 3 months, but however, hardly within a week's time and all one can do their normal activities. There is absolutely no problem. There are many types of rhinoplasties. The rhinoplasty based on the sex, we can call it as a male rhinoplasty, female rhinoplasty, transgender rhinoplasty, teenage rhinoplasty, old age rhinoplasty. These are the different rhinoplasties based on the sex. Based on the approaches, there are different rhinoplasties which we call it as an open rhinoplasty, and there is called as closed rhinoplasty. In open rhinoplasty, there is only the only difference between open rhinoplasty and closed rhinoplasty is in open rhinoplasty, one would have an extra incision at the base of the columella. That is the only difference. Yeah. Other than that, there is nothing much about the open closed rhinoplasty. Well, there are many myths following rhinoplasty. However, people will ask, does following the rhinoplasty, does it change the overall looks of my face and everything? No, absolutely only the size and shape of the nose will be altered. The face will be looking, as usual like before only. Only here we are only going to enhance the way the nose looks. So that is one of the first thing. And the second thing, many people will ask following rhinoplasty, would I have any breathing issues? Because we usually following rhinoplasty, we advise the patients for the first week not to sneeze or blow from the nose. So one would have a little bit of congestion in the nose, which is temporarily. Other than that, there is no major issues. And some people will tell, when you do an osteotomies, it might lead into blindness and all this. These are all the myths. Yes. But sometimes what happens if the rhinoplasty is not done under proper planning and this thing and unexperienced surgeons, it might lead to some complications. But there is nothing to be worried about undergoing a cosmetic rhinoplasty. Well, there are many types of implants that are used in rhinoplasty. One we can call it as artificial implants, which is silicone-based implant. Then we have a cortex implants, which is polytetrafluoroethylene implant. Then there is something called as Medcore implant. These are all synthetic implants which are manufactured from outside. Then there is natural implants which are taken from the patient's own body. It's from the ear cartilage you can take. You can have it from the ear cartilage. You can take from the hip and you can take from the rib cartilage also. But most of the times, it is always better to go for autologous implants, which is taken from the same patient's same body, rather than going for artificial implants. But not all patients require implants. Patients who has a severe deformity of the nasal bridge only requires implants. Other than that, most of the cosmetic rhinoplasty doesn't require any sort of augmentation with the implants. Well, in rare incidences where some patients might require a revision surgery, people who are not happy with the first surgery, and people who are having a severe deviation after the first surgery, and people who has an asymmetrical nostrils after first surgery, and patients after 1 to 2 years of time also with the complaints of a bulbous nose following the first rhinoplasty. Basically, who are typically not happy with the first surgery can go for a revision surgery. But it is always advisable to wait for 6 months, minimum of 6 to 9 months, I say, to go for a revision rhinoplasty. Well, a good nose job is a nose that usually suits the overall appearance of the particular individual. A bad nose job is a nose job which doesn't suit the overall facial aesthetics of the particular individual. So it is always better to give a nose that suits the individual and the nose which will be harmony with the rest of the structures of the face. Well, rhinoplasty, different type of rhinoplasty, like Asian rhinoplasty, ethnic rhinoplasty, African rhinoplasty, American African rhinoplasty, and we call it as also Eastern rhinoplasty, which is done in the Arabic countries and all. Usually, yes, the nose job should be done based on the ethnicity of the individual and all this. Not we should not change the ethnicity of the nose. It's always better keeping in the mind the ethnic origin of the individual. The nose job should be performed. Yes, as said, following rhinoplasty, yes, one can gently touch their nose after 2 weeks after rhinoplasty, but however, one needs to be very gentle with the nose. Though one can squeeze and blow from the nose, and one can resume their mild activities like exercises and all post surgery after 2 weeks. But one should not apply major pressure on the nose. Yes, one can definitely touch their nose, but they should be very gentle. Well, the results of nose job are usually permanent. One can say that the results would last up to mid 50s or 60s. As you know that once after 60 years, people will have aging effects. So definitely after 50, mid 50s and 60s, yes, the nose job results won't last that much because as the facial tissues tend to sag, definitely it will have an impact on the nose also. Yes, nose also tend to droop. So, but anyways, it's going to stay up to mid 50s and 60s. So one need not to be worried. Yes, the results are lasting. Maybe you can say up to 50 and 60 years post rhinoplasty. Well, the minimum age for rhinoplasty is 18 years, and though there is no maximum age limit, I think we have a patient up to 68 and 70 years also these days who are coming for a cosmetic enhancement of the nose. So one can say the minimum age is 18, the maximum age limit could be up to 70 also if the patients are medically fit. Yeah, they can undergo up to 70, 75 years of age also. I think in some countries, some people are going at the age of 80, mid 80s also, they are undergoing a cosmetic enhancement of the nose. Well, these days rhinoplasty is having a bit of bad influence on many young individuals, both male and female. So one need to be careful. If you are really happy with the overall appearance of the nose, I don't think so that one should choose a cosmetic enhancement of the nose. Yes, one can undergo a rhinoplasty, that is cosmetic enhancement of your nose. If you are really not happy with your overall size and shape of the nose, if your nose is big and you want to make it small, if your nose is small, you want to make it big, and you want to make it harmony with the face, you can undergo, but should not get influenced by your celebrities or idols and think that the surgeon can make a similar nose like your idols and celebrities, which is definitely not possible by any surgeon. Well, in rhinoplasty, different surgeons use different type of anesthesia. Some surgeons use the IV sedation, that is intravenous sedation, that is conscious sedation. Some doctors use general anesthesia. But here, most of my surgeries are done with intravenous sedation, that is conscious sedation. I hardly use any of the general anesthesia. The choice of anesthesia again depends on the patient requirements and again the choice of the surgeon. Yeah, it depends. Basically, it is IV sedation and general anesthesia. Both are good. It's based on the patients and the surgeons. After they discuss with the patient and the surgeon, what can undergo with any general anesthesia or IV sedation. Both can be. Well, many people ask whether the surgeon or the doctor can use the nose what exactly the patient wants. Definitely, what the patient wants, the exactly same type of nose cannot be given by any surgeon. Yes, some amount up to 60 to 70% of the nose can be definitely achieved what patients are expectations. So 100%, there is no 100% in any surgery. Yeah, definitely 60 to 70% of the nose what patients want can be definitely given by a surgeon. Well, I cannot say all surgeons, doctors are artists. Yeah, most of the surgeons, most of the cosmetic surgeries, I can say a bit of artistry. But it is not similar like artistry. As I said, only 60 to 70% of the artistic work can be done on the human body. It's not like artistry, what we do a normal drawing or painting on the wall, sculpting. Yeah, the face is a difference, the face dynamics is because it's after all a human body. So you cannot expect what exactly artist or sculpture is done in the and then are living the objects. Yes, and 60 to 70% definitely artistic skills. Yes, artistry work can be done in the cosmetic surgery. Yeah, as I earlier discussed, yeah, if any individual, male or female, comes with the pics of the celebrities or ideals, I definitely, most of the cosmetic surgeons, I don't know, as for me, I don't usually perform surgeries on such patients because these are the people with unrealistic expectations, and definitely they are not going to be happy if they undergo a rhinoplasty also. So it is always better to have a realistic expectations, and they always it's better that they go undergo a rhinoplasty, which is a cosmetic enhancement of the nose, having the realistic expectations on the mind and keeping the rest of the facial features in the mind. So the rhinoplasty will be performed at such individuals with realistic expectations, and that suits the aesthetic balance of the rest of the face. Well, the cost of rhinoplasty varies. A simple rhinoplasty can cost to around 70,000 to 80,000 Indian rupees, which can go up to 2 lakhs also. It's based on the again based on the type of enhancement we are doing, based on the augmentation work. Sometimes they are using implant, the cost can be higher. Depends on the approaches and all these things, whether it is reconstructive rhinoplasty, simple rhinoplasty. If they are going for a revision rhinoplasty would cost almost double the primary rhinoplasty. So yes, the cost varies. You can say the simple rhinoplasty could cost you around 80,000, and the complex rhinoplasty, which one requires the complete enhancement of the complete nose, could go up to 2 lakh rupees also. The cost varies from clinic to clinic, geographic location, surgeon to surgeon. Well, the secondary rhinoplasty. The secondary rhinoplasty is a rhinoplasty which is done on an individual who has already underwent a first rhinoplasty elsewhere or in the same clinic. Yeah, there is little. Secondary rhinoplasty is always difficult because following first rhinoplasty, there would be having a amount of little bit of fibrous tissue. And little bit of tissue distortion also will be there. Yes, definitely the time factor is more in the secondary rhinoplasty. So secondary rhinoplasty is definitely a difficult job because it is a connective surgery. Yeah, it is definitely difficult. The secondary rhinoplasty or a revision rhinoplasty is definitely difficult than a primary rhinoplasty. Well, many surgeons these days perform rhinoplasty, such as maxillofacial surgeons, ENT surgeons, plastic surgeons. Yeah, one can choose the rhinoplasty surgeon based on the surgical background of a surgeon, based on the number of rhinoplasty surgeons he or she has performed, based on the experience definitely, based on the years of practice in rhinoplasty, and definitely based on the before and after results of the surgeon. One could, when you visit a surgeon, it's always better you ask for his past works, definitely about his before and after works, and if possible you can ask the surgeon to share and show his some of his past works, pictures along with some videos also. Yeah, based on these all things, one can choose a better rhinoplasty. Well, I hope that most of the questions pertaining to the rhinoplasty have been answered. I would be very happy if you have any further queries, you can just drop your queries in the comment box, and I would be very glad to help you. And you can visit me personally at my clinic at the below address, and I would be very happy to share my works and glad to help you in giving you the best aesthetic outcome that I could give to you. Thank you very much. In the next video, I will be talking about other facial cosmetic surgery. Thanks a lot.